I'm Steve Wilkerson, and I'm with Jim Saunders, Executive Editor of the News Service of Florida. Jim, the budget bills, the all-important budget bills in the House and Senate are going to the Appropriations Committees this week, and then shortly after that, they'll be going to the floors of the House and Senate. And surprise, surprise, they are currently about $4.2 billion apart and $5 billion apart in the medical area alone. I don't think people anticipated quite this chasm. Discuss. Where's it going?
Well, I don't remember ever seeing budgets that are that far apart at this point in the budget process. The big issue is differences in health care. The Senate budget includes $2.8 billion in federal money to expand health care coverage for low-income people.
And that's when we hear low-income people, that's when we hear this term LIP, right?
No, there's two different issues.
All right, well, maybe
two different issues going on. $2.8 billion dollars to expand health care coverage under the Affordable Care Act. Right. The Affordable Care Act was intended for it to be expanded under Medicaid.
Right.
The Senate has kind of come up with an alternative to take that money and expand it to the same group of people through private insurance. The House wants no part of that, but the Senate has included it in their budget. So there's $2.8 billion right there. Right. The other issue which you referred to is called the low-income pool, which is, or LIP, as we call it, and it is a $2.2 billion issue. The LIP program is a joint state-federal program, and it's scheduled to expire on June 30th. What this program does is provides extra money to hospitals, primarily hospitals, but some other types of health providers, to care for low-income and uninsured people. That's why there is a lot of linkage in the Senate, at least, on these two separate issues.
And that's a lot of money for some hospitals, right?
It is a lot of money for some hospitals. You know, the ones that are considered safety net hospitals, teaching hospitals, Jackson in Miami, Shands Jacksonville in Jacksonville, Tampa General, some of those hospitals that serve a lot of low-income and uninsured people, this is a crucial issue to them. But right now, we don't know whether the program is going to be extended past June 30th, and if so, in what form. The feds have made clear that they want changes in the program. So the Senate has included that money in its budget. The House has said, no, we're not going to include it at this stage. If the money comes through later in session, we'll add it back in. But so right now you add the $2.8 billion, the $2.2 billion, you got $5 billion in the Senate healthcare budget that's not in the House healthcare budget, and that's creating a huge, huge gap.
What are some of the leaders right now? How are they posturing around all of this? Or does the House just think that, if we don't get the LIP approved, and then the hospitals out there will just have to eat this, or are we talking special session? What are we doing here?
At least publicly, the House seems fairly confident that the LIP program is going to get extended past June 30th.
By the federal government? By
the federal government. There's negotiations going on right now between the federal government and the state Agency for Healthcare Administration to try to work out an extension. The feds have made clear that they want changes in the program. They provide about $1 billion of that $2.2 billion. So they got a big stake in it, and they need to approve it if it's going to continue. The House seems relatively confident that, or at least publicly, that the program is going to be extended with some changes, but they just basically say we don't need to put this in our budget right now until we know for sure whether it's extended or not. The Senate is, kind of in line with the hospital industry and other healthcare providers who are very worried that LIP will not continue, which would mean they would be out a whole bunch of money, and that if the expansion of healthcare coverage under the Affordable Care Act doesn't happen, they wouldn't be getting that money either for patients who show up in their emergency rooms. So right now, it's, they're sort of talking past each other almost between the House and the Senate. I think the key is just going to be watching as time goes on what happens with this lip issue. Personally, I think that's sort of the key in this whole process. There is a lot of speculation about possibly a special session. There's always that speculation, though, when there's difficult issues, because people love the drama. And quite often it works out. But there's a lot of talk this year. It's complicated, and it's a lot of money, and it might require a special session to deal with.
Well, when you have a chasm like that at this point, nearing midpoint in session, it can have a ripple effect on other issues as well, not just health care. For example, education spending. That's been a very high priority of the governor in his budget. What's happening on that?
Well, just to back up for a second, worst case scenario, if LIP didn't get extended and the son of Medicaid expansion doesn't happen, the state might have to be looking at putting a bunch of general revenue or find some other funding source to help these hospitals and providers care for low-income people.
Which could affect other areas.
That would be a major ripple through the budget if they have to take money from somewhere else and put it into the healthcare system. That would be a major effect. I do think that the education funding issue is a pretty important thing to watch. Governor Scott campaigned across the state last year vowing to have the highest per student funding level for public schools in state history. He's made that a bedrock of his campaign. Part of it was because Charlie Crist was running against him, and when Charlie Crist was the governor before, he had the highest level. So, I think there's a political angle there too. But the governor has proposed the highest level. Neither the House nor the Senate at this point have come really close to where the governor is. The House does have enough money in their budget that they would exceed the historic level by like $3 per student. The Senate is just below the historic level by like $3 per student. So they're really not that far apart between the two of them, but the governor may put his thumb on the scale here pretty soon and say, we need more money to go into public schools. I promised it, we need more money. So that is a pretty big issue, and it's a high profile issue for, education funding is always one of the highest profile budget issues.
Well, another thing we heard from the governor about prior to session, another subject was tax cuts in a variety of areas, communications, textbooks for universities, doing away with taxes on those, and so forth. Well, tax cuts don't look so good right now if you're looking at a huge difference in revenue expected between budgets and so forth and so on. How are tax cuts going to fare in this environment?
Well, again, the governor has made last year, and he's continued. He is on the road all the time talking about this, the need to cut taxes. He proposed, I believe it was $673 million in tax cuts. The House Speaker has said, we want to be north of $500 million. But I think all these other issues could play a role in determining just where they can arrive and how large they can go. There are bills moving through the Senate, have been fairly steadily moving through the Senate to cut taxes. Communication services tax is the big one. That's what the governor has made his priority. He says if you cut the taxes on people's cell phone bills and their cable TV bills and their satellite TV bills, it's real money for real people, basically. That's his position. That bill started moving in the Senate, and there's other tax cut bills moving in both chambers. But I think in the end, this is going to be an issue that, as always, gets wrapped up in the budget in terms of how much money is available and how do you distribute those tax cuts with the amounts of money available. Because if there's only $500 million, if there's $500 million available, legislators are probably not going to put all of that in the communication services tax cuts. They want other things too. So, it all has to fit together in the end.
A lot of balls up in the air at midpoint in session.
Yeah, I think it's going to be late in session when we find out what goes on with this lip issue, where a lot of things might spring loose if we find out what's going on with the lip issue.
Thank you, Jim. For more news about Florida politics and government, visit the Advances section of our website.